My name is Manuel. I'm about to do persuasive speech on malaria prevention to convince the audience about the importance of the two main malaria prevention methods for travelers when traveling to malaria infested regions. The two main prevention methods are to take anti-malaria drugs and to prevent mosquito bites. Now, a lot of information and research have been done to this effect. The director of the Center of Disease Control and Prevention (CDC) in 2013 stated on the CDC Journal of Real Life, Real News, and Real Voices that 94% of U.S. residents with malaria did not take the preventative measures correctly. Now, traveling to other regions, you have to get all the preventative measures in place. We have 94%. I got this from the website, by the way. We got 94% of the U.S. residents did not take preventative measures from the CDC website. Okay. Now, also, according to the research study of malaria prevalence among travelers in Nigeria, done by Parasite Rest in 2015, the study was carried out at the Aviation Medical Clinic Laboratory, Murtala Mohammed Airport, Lagos, Nigeria. Blood samples were collected from 51 sick travelers and tested for malaria parasites. 22% of the travelers were tested positive. Now, study shows high likelihood of occurrence of malaria in other countries, especially in Western countries, which do not even harbor the Anopheles mosquito. Now, it is for sure that most people who travel from Africa back to Western countries, they leave and maybe carrying the malaria parasite without even know. That's a mosquito right there giving a nice package to this gentleman going back home. He does not even know what the mosquito package is for. It's just a nice package of malaria parasite from an Anopheles mosquito. Now, children are the most vulnerable to this disease. Nearly 2/3 of the deaths of malaria are children under the age of 5. Pregnant women are also very vulnerable to malaria. Malaria prevention is very important, but this is not by getting into a direct fight with mosquitoes like my dear friends out here are using fly swipes to kill mosquitoes when they have traveled. They are using a bad preventative measure. Now, the best way to prevent malaria is by the two methods that I just mentioned. Knowing where to get preventative medications and how to prevent mosquito bites are the key points. Anti-malaria medications can be obtained by visiting your healthcare provider 4 to 6 weeks before you travel, or visiting health information programs like the SHIP. It is the Sea First Health Information Program that gives full information about preventative measures of malaria for travelers. Some anti-malaria drugs can be started a day before you travel. This means that last-minute travelers can still benefit from a visit to a healthcare provider, and they can stay free from malaria if they get these medications just one day before they travel. Obtain your prescriptions before you travel to any of these regions that are infested with malaria is very important. Now, why do I say this? Most areas that are infected with malaria definitely are third world countries. These are countries in the tropics. Now, what happens is that in these regions that are third world countries, that are poverty-stricken countries, they usually have fake drugs in their community. So living from here and going over to third world countries that you want to get these medications, you stand a chance of getting a fake medication, which is not going to work correctly. Okay, now minor side effects of anti-malaria medications are vomiting, diarrhea, and sometimes nausea. Now, these side effects subside after a little bit, so please do not stop taking anti-malaria drugs before you leave. Avoiding mosquito bites is very, very important, and there are a ton of ways to avoid mosquito bites. A lot of research has been done to this respect, and avoiding mosquito bites have a series of ways. Number one, dump out any standing water near your home. Mosquitoes can breed in just 14 days in a minute amount of water. In an old flower pot, or maybe in a rain gutter, or maybe in a bed bath. Keep mosquitoes outside. Now you can use either a screen on the windows, you can use either air conditioning, or if you don't have air conditioning and all that, you can just buy a net and put over your bed or your crib. That mosquitoes cannot pass through. You could also use a mosquito repellent. The repellents can do a pretty good job keeping the mosquitoes at bay. Now, wear light colored clothing, especially when outdoors. Apparently, deep colors like black, deep blue, and red are standout colors that attract bugs, especially mosquitoes. Thicker fabrics and looser fits are better because the mosquitoes stand less chances of getting right to your skin in order to get a chance of getting some blood off of you. Stay indoors during dusk and dawn. This is very, very important. Mosquitoes feed all around the clock, that's for sure, but they have their favorite periods of feeding. It is at dusk and dawn. Now, these are considered the special time when mosquitoes feed. When it's dusk and dawn, you can see the mosquitoes with the calories or the smiling face. They know it's time to enjoy a good meal. Now, make yourself less appealing to mosquitoes. Also, keep the mosquitoes at bay. You'll be surprised that two people are walking, but one person gets bit by mosquitoes more often than the partner. Why does that happen? Sometimes one person is simply appealing to mosquitoes than the other. Mosquitoes are attracted to people who have more body odor than others. Now, if you drink maybe 12 ounces of beer a day, makes you much more appealing because you carry a body odor. Now, if you have an infection, definitely you do have a body odor, and mosquitoes are attracted to you even more. So you're gonna get stuck even more by mosquitoes. Now, following all these little rules out here can help keep mosquitoes at bay and keep malaria at bay for people who have traveled from regions of non-malaria infestation to infested regions. I'll take the two main principles out here, the two main preventative measures. Travelers can do well to prevent malaria by respecting these two rules. Take the anti-malaria drug, prevent mosquito bites, because prevention is always better than cure. Thank you very much for listening.